episode 5 of our vlogcast, Clinical Virtual Assistants at the Point of Patient Care. I'm Erin Bina. In our last episode, we discussed how COVID-19 is shaping the view of AI and other technology in the hospital. Today, let's talk about what is most overwhelming about the whirlwind of information in your clinical work setting. What distracts you most?
To me, it's the sheer volume of interruptions. And I quantify those as being interruptions from nursing or other healthcare staff that have a clinical question, or a phone call that might be coming from a pharmacist, or a doctor in an office who wants to talk to you, or a doctor who wants to transfer a patient to you, documents that you have to sign for compliance and legal reasons. And then sometimes you have cases that escalate quickly. A patient might deteriorate, or a new patient arrives unexpectedly that kind of demand your attention and remove you from whatever you're doing at the time. And so once you're done with that task, you have to kind of reset and figure out, what on earth was I doing before I got into doing this?
And I spend a lot of my time performing tasks that are repetitive and that do not require all of the training and education that I have obtained to be a physician.
And then there are things that we do just on a day-to-day basis that are just a pain in the rear end that have to do with how many times you have to document, and documentation has just gotten to be ridiculous.
Data overload. Like we have so many streams of data now, beyond sort of going into the room and evaluating a patient. Like there's so many streams of data from all the monitors, from all the lab values in the EHR, from all the imaging data, and so trying to integrate that data together in sort of a fast-paced environment, whether that's the ICU or the ER, is very, very difficult.
So on balance, do you feel that technology has helped or hurt?
I think technology is, of course, helping. And I think that's evidenced by just the sheer volume of patients and the sheer amount of care and the complexity of care that we are currently giving as compared to what we used to be able to do when everything was much more manual and labor intensive. I think from a con perspective, I think we really need to be mindful of how and when and where we use technology.
So we have cumbersome systems that communicate poorly with each other. And they're focused really on documentation for the sake of charge capture and billing, rather than for acting as a comprehensive data repository that is easy for people that care for patients to extract information from. And so, as I mentioned, I think it's a mixed bag, and there's definitely room for improvement.
I think for the most part, this is the technology that we live with, and on balance, it's helped, and we certainly don't know any other way now. I mean, if you think about it, every time the EMR goes down, it's a small disaster, and so that, I think that alone shows you that it's probably helpful.
Mm-hmm. And I'm wondering, have you seen or experienced periods of information overload that have possibly contributed to stress or even compassion fatigue?
I mean, I see fatigue from an information overload. It's also nurse-patient ratios.
I think we tend to dehumanize patients, both doctors and nurses. So, the patient's referred to often by bed number or condition, the appendectomy in bed 10. And I think that does dehumanize. And I think, unfortunately, computers dehumanize, because the clinician and increasingly the nurse at the bedside are spending more and more time typing things into computers, looking at them, rather than that human contact with the patient. So it's one of my little idiosyncrasies that it's not the appendectomy in bed 10, it's Mr. Smith who had the appendectomy, who happens to be in bed 10.
The entire hospital is like an ICU, and acuities and risk of all these patients are so much higher that your brain has to just be in a hyper agitated state all the time. And that increases your fatigue.
Those were very thoughtful responses. Thank you so much all for sharing those. And another potential concern with technology is our own comfort level with advanced AI and how much it learns about what we do. We'll discuss that and more in our next episode. Hope to see you then. Thank you.